And we're back now with Democratic Senator Mary Landrieu from Louisiana, Ohio Senator Sherrod Brown, and Republican Lamar Alexander from Tennessee. Well, you heard Senator Snowe. She was one of those, Senator Brown, who was very much almost really wanted to vote for something here, and in the end just couldn't bring herself to do it. You were one of those who very much wanted a lot more than what's in this bill, in the sense you wanted a public option. You said you're going to vote for it, but are you happy with it?
I'm disappointed. I think it could be a better bill, but we're making major progress in this bill. I mean, first of all, for those people who have insurance in this country, right now you're paying more than You're paying $100 a month, more than $1,000 a year, a hidden tax for basically for care for people who don't have insurance to go to emergency rooms and all that. This bill's got good insurance reform. It says that no more pre-existing condition, no more exclusions for that. No more discrimination, women paying more for health insurance than men. It strengthens Medicare. It provides free screenings for Medicare for every Medicare beneficiary. It lengthens the life expectancy of Medicare. And it gives tax breaks for small business. And those start immediately so small companies can begin to insure their employees. Most companies that in Cincinnati and Cleveland and Columbus that I talk to want to insure their employees. They simply can't afford it. If they have 20 employees, one of them gets cancer, it makes their premiums unaffordable. So this bill moves absolutely in the right direction.
Are you convinced people are going to pay less, that this is going to reduce costs?
I know what happens.
I keep hearing people say it's going to cost a lot more.
This bill, if we do nothing, insurance premiums are going to double. You know, I'm amazed as I hear Republican after Republican take to the Senate floor and defend the insurance companies' practices worthy of Ebenezer Scrooge. And the way they'd have it is that the insurance companies would cancel Tiny Tim for pre-existing condition. I mean, it's clearly not sustainable what we're doing now. We clearly need to go on a different path.
So, Senator Alexander, as a Republican, I take it you don't quite agree with that, but let me ask you this. Republicans have done everything they can, and openly, they're not making any secret of it, to slow this process down as much as they can. Is it now done, or will you continue to try to slow this vote down?
Well, no, it's never done in the Senate until it's done. And I thought Senator Snowe pretty eloquently explained why we want to know more about the bill. I mean, there's a reason why we're voting on it in the middle of the night. We just learned about it yesterday. They're trying to push it through before Christmas. There's a lot of explaining to do. I mean, how are you going to help Medicare by taking $1 trillion out of Medicare over a 10-year period at a time when Medicare is going broke in 5 years according to its trustees? How will taxes help create new jobs when we've got 10% unemployment? How are governors going to pay for the Medicaid expansion? Almost all of them are saying they'll have to raise state taxes, they'll have to raise college tuitions. And then what about the 16 million Americans, low income, who are getting dumped into Medicaid, the program for low income Americans, where 50% of the doctors won't even see new Medicaid patients.
So let me get back to the question.
So there's a lot of explaining to do.
Let me get back to the question I asked you. Are you going to continue to try to slow this process down, or are you going to let it come to a vote?
Well, we want to take the time to let the American people know what it costs, what it is, how it affects them, because we believe when they find out, they won't like it any better than they do now, and they won't allow Congress to pass it.
Do you believe it is possible to keep this from coming to a vote before Christmas?
I'm not sure. We'll have to see. But it is outrageous in the middle of a snowstorm to give us a 2,700-page bill yesterday, start voting literally in the middle of the night, and say, let's pass it before we go home for Christmas.
Senator Landrieu, you were one of those like Senator Snowe who was very much on the fence. But then somehow in what people are calling the Louisiana Purchase, $300 million in Medicaid help for your state came your way, and you suddenly were able to vote for this.
Bob, let me be very clear. Nothing could make me vote for a bill if I didn't think it was the right thing to do for my state and for the nation. Nothing, no amount of money. That was one of about 12 things that I fought very hard for, and I'm pleased to say in the final bill, many of them have presented themselves. One, Sherrod mentioned tax credits for small businesses. I'm the chair of the Small Business Committee. I was not going to support a bill that didn't have robust help for small business. I was not going to support a bill that had a small business mandate. So there were a number of things. That was just one. And it was a very worthy request in the sense that after Katrina, our calculation for Medicaid put us in the same category as Connecticut. People know that Connecticut is a much richer state than Louisiana. But having said that, I'd like to answer the question you asked Lamar. There's only one reason we're going to be here till Christmas, and that's Senator Tom Colburn. We don't have to vote in the middle of the night, but he's the one making us do it, not Harry Reid, not the Democrats. It is a Republican obstructionists that are making us vote in the middle of the night. Number two, we've been discussing this issue for 40 years, not 4 months, not 4 weeks. 40 years we've debated this. And since last March, this discussion has been public. So this business about they don't know what's in the bill, it's been widely distributed. The language has been on the internet. We are going to get this done before Christmas, and it's extraordinary that Democrats, Sherrod, who started out for a robust public option, I was not necessarily for that much government involvement, have come together to write what we think is a great, very good, great bill for the American people.
The Democrat leader,
Senator
the assistant
Senator
Democratic
respond.
leader, Dick Durbin, said on the floor last week he didn't know what was in the bill. We got a 400-page amendment yesterday. The reason they're rushing it is because they don't want people to know about the Medicare cuts, the tax increases, and
That
the
is
chief
not true.
actuary of government has said that rather than decreasing costs, it will raise costs over the next 20 years. That's the chief actuary of government in the Obama administration said that.
Let me put a
That is
human
not
face
true.
on this. In Toledo and Dayton and Piqua, Ohio, 390 people every single day are losing their health insurance. 390 people a day. Across this country, 1,000 people a week die because they don't have health insurance. A woman with breast cancer is 40% more likely to die if she doesn't have insurance than if she does have insurance. 40% more likely. So this kind of obstruction, I mean, this gang of six started meeting formally in June, but much before that, as they started negotiating this bill. Everybody knows the great majority of what's in this. Everybody's debated it. Everybody is, and it's just a question of delay. I mean, in the end, and I like Lamar and I like most of my colleagues on the other side of the aisle, but it's so much what the insurance industry wants. The insurance industry stands to lose a lot. CEO of Aetna made $24 million last year under this bill because we've got a provision in this bill that no more than 15 or 20% of every premium dollar can go to the insurance companies. The rest have to go to hospitals and doctors in Knoxville and in Baton Rouge and in Columbus.
The fact
so
of the matter,
that means that insurance companies are going to come to the table and going to have to give a little bit up.
Sherrod Brown or any other person explain to me how you're going to take $1 trillion out of the Medicare program on which 40 million seniors depend, which is precisely the amount when the program is fully implemented, and not spend it on Medicare, not spend it on grandma, but spend it on somebody else. That's
All right,
absolutely
let's-
at a
first
time
of
when the
all-
program
first
is
of
going
all-
broke in 5 years.
First of all, we don't take $1 trillion out of Medicare. We take a couple of $100 million by streamlining the program.
Now, Mary,
we
if the
streamlining
CBO
the
says
program.
it's $1 trillion over
It's-
10 years when fully implemented.
It is not $1 trillion over time, and Republicans like John McCain and Lamar Alexander have supported many of those same ways to streamline Medicare in the past. John McCain actually ran on some of this. So to claim that we're doing something that Republicans and Democrats haven't tried to do for Medicare, we're strengthening Medicare. That's the bottom line. 7 years expanding that trust fund, and we're taking some of that money and providing tax cuts and tax credits for small business. And for the first time in America, Americans will have an opportunity to have the same kind of insurance that federal employees have, including members of Congress. That's a promise the president made, and we're keeping it.
And the AARP and the American Medical Association wouldn't be supporting this bill if it were
Right.
substantially cutting Medicare. Most of the cuts, the reason, when you throw a rock into a pack of dogs, the one that howls is the one you hit. And most of the people, the reason that the Republicans are howling on the Medicare quote unquote cuts is because we're cutting insurance company subsidies that have gone to Medicare. So you take those subsidies out, of course they're unhappy with that because the insurance companies are their biggest supporters in election after election.
This is exactly why we shouldn't be voting in the middle of the night and passing at Christmas. They are saying that tax increases aren't tax increases. They're saying that $1 trillion cut in Medicare spent on a new program isn't $1 trillion cut in Medicare. They are ignoring the fact that they're dumping on states new expenses for Medicaid that in my state, our Democratic governor has said is the mother of all unfunded mandates, will cause tax increases and increases in college tuitions, and they're dumping 16 million low-income Americans into a Medicaid program, which 50% of the doctors in which they won't see new patients.
Bob, let me just add this. They're going to be 94% of all Americans are now going to have health care. This is being done through a private-public partnership, not a government takeover, but reform of the insurance industry that people even have insurance are desperate for. And it is not being done, you know, in a very quick way. As I said, we've been debating this all year. So we're ready to come to this great compromise that we believe that brought the Democratic Party together. We wish the Republicans would have joined us, but it's easy to be unified when the only word in your vocabulary is no. That's all they've been able to say to the American people. It's time to say yes to them and get on with the job of governing.
Let me tell you why this is no longer business as usual.
About 10 seconds.
Okay. In 2003, when the insurance companies and the drug companies and President Bush pushed through the Medicare privatization bill, they had they were not paying for it in any way. We are paying for this bill. Congressional Budget Office says it'll be over the next 20 years. It'll be a $1.4 trillion pay down to the national debt.
All
This
right,
is Congressional Budget
10
Office saying
seconds.
that.
Senator
Medicare
Alexander.
cuts, tax increases, big new taxes on states, and dumping low-income Americans into a Medicaid program where half the doctors won't see new patients.
We will continue this conversation. We're out of time.